If you've tried oral medications or other erectile dysfunction treatments and have found them ineffective or intolerable, you may be looking for a more long-term solution, like the Titan penile implant. Understanding how important intimacy and spontaneity are, this can be a great solution for you and your partner. The penile implant allows you to be in control of your erections without any external equipment. This device produces a reliable and effective erection. With the penile implant, you no longer need to worry about your erections and can focus on providing satisfaction to your partner. The penile implant is placed inside the body through a small opening or incision in the skin. This is typically completed during an outpatient procedure. During the procedure, cylinders will be placed in the shaft of the penis, a pump in the scrotum, and a reservoir, typically in the lower abdomen. All components are placed alongside existing anatomy. Most men return home on the same day of their implant surgery and can resume light activity within a few days. On average, it takes about 4 to 6 weeks to return to strenuous exercise and begin to inflate and deflate the implant. Before you begin to operate the device, you'll have a checkup, and I'll provide you with instructions for returning to sexual activity and the proper use of your implant. With any surgical procedure, there are risks and complications that can arise that could change your length of recovery. After the recovery period of 4 to 6 weeks, you'll be able to return to normal activities. Once you're cleared to use the implant, most patients will be able to engage in all forms of sexual activity not limited to intercourse. For most patients, the penile implant procedure and device itself should not impact the ability to orgasm or ejaculate. At this time, most patients will also be able to return to day-to-day activities. All types of physical activity are usually possible, including swimming, biking, riding a horse, and all activities that patients were used to doing prior to the implant procedure. The Titan implant is a MR conditional, which means it can be safely scanned by an MRI machine when the scan is done according to specific conditions. After your implant, you will receive a patient implant card containing these specifications that can be provided to the imaging center before an MRI. Like other implants such as those for knees or hips, the Titan implant may appear when going through airport security. After your implant procedure, you will receive a patient implant card that can be presented upon going through airport security. Some men alert security personnel of their implant and show them their implant card before they step into the security X-ray machine. Most insurance companies, including Medicare, cover the implant. It's important to be aware that there are multiple factors to consider when it comes to insurance. Coverage and costs vary based on your policy, and my office will work with you to help determine your individual coverage and any associated out-of-pocket costs.